Welcome to the Luke Commission. Founded in 2005 at the height of the HIV and AIDS crisis, the Luke Commission brings free, compassionate, comprehensive healthcare to the most isolated and underserved people of Eswatini, a small country in southern Africa. Through the fixed site Miracle Campus and through mobile health outreaches, in 2020, the TLC team of over 500 staff hosted nearly 117,000 patient visits. Since the arrival of COVID-19 to Eswatini in March 2020, TLC has served as part of the national response, adapting and innovating to care for severe and critical COVID-19 patients in our inpatient facility.
On the 11th of December, which was a Friday evening, we received 16 critical transfers from other facilities in Eswatini. And it was at that time we knew that the second wave had hit. It came very quickly and it came very hard. That night, we received 16 critical admissions in 4 hours. They came from all over the country, from other facilities and ambulances. They were coming so fast, they were just being put beside the hospital. We were working very hard to stabilize them. A few days into the second wave, we realized that we weren't getting the supply of oxygen that we should be getting. We quickly raised that to senior leaders in our nation who did everything in their power to increase the supply of oxygen that we had in Eswatini. Unfortunately, South Africa was also having a high number of cases and a high number of hospitalizations and a high number of people in the ICU, which meant that all of our supply of oxygen was coming from South Africa. So it was very difficult to get more oxygen when the country that's supplying you with oxygen also has a shortage themselves. What we knew from the first wave is the only real treatment that we have for COVID is oxygen. The one thing we needed more than anything was oxygen. And the one thing we did not have enough of was oxygen. For the past 2 months, we've had 14 people a day, 7 people on the night shift, 7 people on the day shift. For 12 hours, they've been pushing cylinders around. Between 150 and 180 cylinders per day that have to be moved from the patient bedsides. The number of people on ventilators, the number of people on high-flow nasal cannula, they were requiring high amounts of oxygen. Unfortunately, we were forced to turn down the oxygen levels on some of those pieces of equipment. Every day, we were having ambulances come in with people who are saturating in the 30s, the 40s, the 50s, severely critical. And the team did what it took to stabilize those patients and give them every chance to live. Unfortunately, many of them died. And in the midst of the pain of COVID, which is in and of itself enough, we didn't have enough oxygen. It was at that time that we knew we needed to start working on doing something different. It was very important for Eswatini to be able to produce their own oxygen and not be dependent on another country. So I know if we can bring oxygen, which is the giver and the keeper of life, to this campus, it will breathe oxygen into our nation. We'd already been working on plans to install an oxygen production plant at the Luke Commission, and we decided that we had to jump off the cliff and do it very quickly. We decided to use our credit line or our overdraft to pay the initial deposits. And so we are in the process of installing that plant, and it is our hope and our prayer that that plant will be commissioned by March 2021. So that we will be able to have and produce our own oxygen here on the campus, not just for ourselves, but also to do health system strengthening and other facilities in the nation.
As COVID emerged, one of the greatest resources to being able to treat patients and provide a high level of care became the supply of oxygen. For us in Eswatini right now, that looks different than it probably does for others. For us, that means oxygen tanks getting filled 500 kilometers away, getting compressed into cylinders, traveling across border, then coming to our site before it ever reaches the patient bed. And so when we're putting oxygen at the bedsides, we're putting it for our brothers, our sisters, our mothers, our fathers, our kids. The oxygen's not just about getting 10 liters per minute, 15 liters per minute, 20 liters per minute. It's about giving hope no matter what. It's about refusing to quit in the midst of the pandemic. And so what we'll be able to do with the plant is we'll be able to distribute it directly to the patient bedside right from the oxygen plant itself. We'll have a far more predictable and stable oxygen supply environment, so we'll know exactly how much capacity we have each and every day. We really wanted to bring in Eswatini the capacity to provide critical care for COVID, snake bites, TB, other diseases that rely on this critical resource for treating patients.
We really appreciate your support in helping us stabilize oxygen, because if we can stabilize that one thing, it will allow us to refocus on our primary goals and objectives as TLC, and that is to love every person who comes through these gates or enters into our care like our own family member.